have institutional members, other type of associations, individuals, corporations, students, very important for the future, and also nurses. Our mission exists to facilitate the international dissemination of knowledge and experience in telemedicine and e-health, and to provide access to recognized experts in the field worldwide. So we're basically, I would say, a networking society, allowing people to get together, establishing contacts. It's so important to be able to reach out to others. And therefore, we do support activities worldwide. We are basically an umbrella for national telemedicine associations, as I said. We assist the startup of new national organizations. And we are also an NGO in official relation with WHO. So we are recognized by WHO if they have specific issues on telemedicine and in e-health, that they would contact us. And for us, developing countries is a very important part. They are the ones that definitely need the maximum of our efforts. So we have memberships. I mentioned it before. Councils is what we hope will develop. There are none around the world right now. Councils should be organizations mandated by the health authority of a country, could be Ministry of Health or equivalent, to represent the authority in matters concerning telemedicine e-health in their particular countries. It's a little bit based on the idea, in each country you have the councils for HIV/AIDS. Well, we hope that in each country, beyond associations and that, but also in a pool together with the authorities and the players, the actors, that a council can be created that then can end up in practical decision-making at political level. Let's not forget that all this is politically loaded, and we need the support of the authorities. So here is, for the moment, the world map. So besides the 39 national associations, we have now a total of 68 countries that are represented through one or the other membership in the ISFTEH. And we keep the relationship with all these other international organizations. Another important part in the ISFTEH is the working groups. Education is a very important part because we need to reach out and give the opportunity to people to learn through our system. Students is also a very well working group. The nurses as well. Nurses are the food troops. There are thousands and thousands, not to say hundreds of thousands of nurses. They are the persons that quite often are closest to the patients. And the ICN, the International Council of Nursing in Geneva, counts also members from 133 countries. And now they have started also since 2 years an official tele-nursing network program officially within the structure of that organization. Open source is also an important working group, and I can announce that we are about to start a working group on e-health economics, and you will hear later on today at another session by Professor Mars the presentation around economics in e-health, which also is very important to the future. Excuse me. Then a quick word about our annual event. You may have heard about it. Meditel in Luxembourg is going to be the 10th edition, now coming up in April 2012. It's truly international. We have participants from more than 50 countries. I think it was even 58 in this year, 2011. So it's important that all these people gather and exchange their views, learn also for the presentations. There are more than 200 that are made during the 3 days. Then here again, in more in detail, the education. There I'd like to point out, on the website of Meditel, you'll find a section that we've created, Knowledge Resource Center. In there, open access, you find all the presentations since 2002, the abstracts and the PowerPoints. And that is classified chronologically. Secondly, per topic. So you go, for example, cardiology, you'll find all the presentations that were pertaining to that field. third per country, the country of the first speaker. And since this year, we have opened a section called evidence-based, which is also very important. So the first three sections are just a repetition of all the presentations. The fourth is a selection of those presentations that we're tackling the evidence-based solutions. Right now we only have 2011, but we're working at getting back to 2002 as soon as possible. Educations, we have also at Meditel virtual sessions for students and nurses. They can't always travel, so we have a link with them, and we have a selection of 5 presentations by students so that they can participate also in the event, and we can distribute points or credits for continual medical education, which we have through the EACCME. We are also supporting a lot of events, basically of our members, and this is only a very short list, but on the website of the ISFD, you can follow also the ones, systematically all the events that are organized by our members, we support on their request. And there again, if you get to the websites of all the members, you see we can cover the world, and you go in there, and I'm sure that you can discover a lot of interesting information from all the parts of the world. So in conclusion, I'd say what we have implemented, the Knowledge Resource Center, as I mentioned, basic training courses in telemedicine and e-health, which falls from the working group education. We're starting an electronic telemedicine and e-health journal beginning of next year. We support the events all over the world, as we said, CMEs, and we promote research and participation on e-health in developed countries. There is an award grant cooperation with the European Commission. There are going to be a selection of 3 where the European Commission pays for presentation from developing countries, where the European Commission pays travel, accommodation, and registration, and then also the open source. So the role of ISFT is highly valuable as to their ability to provide quality expertise and advice, to mobilize specific resources, and to validate the reliability and efficiency of telemedicine e-health, especially in low resources countries. Thank you very much.